Right. So for the next heart issue in children, which we'll be discussing, is the patent ductus arteriosus. Patent ductus arteriosus. So for the patent ductus arteriosus, you could actually spot out the abnormality right there. Okay. So normally there shouldn't be a connection between the aorta, okay, and the pulmonary arteries. But for this, there's an abnormal connection between the aorta and the pulmonary artery. So when the heart is pumping oxygenated blood, the oxygenated blood eventually mixes up with deoxygenated blood again. Alright, so let's look at it. It's a congenital heart defect in children where a fetal blood vessel, that's a patent ductus arteriosus, failed to close after birth. Okay, so this vessel normally connects the pulmonary artery to the aorta. That's when the child was still in utero. Do you understand? So that's in utero. So if it remains open after birth, it is not needed after birth. Do you understand? This is normal when the baby is still in the stomach. But after the baby is out, this is not needed. You have to know how the body functions. Sometimes the body needs things at different stages. At different stages, the body might not need that same thing that was once advantageous. So what happens in this? In fetal life, the ductus arteriosus is essential for circulation. After birth, the lungs takes over the oxygen exchange. So in patent ductus arteriosus, oxygen-rich blood from the aorta is still flowing back into deoxygenated blood. So it leads to what? Excess blood flow to the lungs. Because blood coming into deoxygenated blood, much more volume. Deoxygenated blood is headed where? To the lungs. Do you understand? So it overworks the heart, overworks the lungs, leading to heart failure. Alright? So please, you can pause to observe this, right? You can spot out the abnormal connection between here. So of course, if a surgery is done to just cut it, rearrange it, the issue will be solved. Okay? So if it is so small, you might not have symptoms. You might even be living with this, you don't know. Alright? So moderate to large, the child is having difficulties in breathing, poor feeding and weight gain, sweating during feedings, they are fatigued up, frequent respiratory infections, heart murmurs. Alright? So you can also spot out the abnormal connection. Okay, yeah, see the abnormal connection here. Okay, so diagnosis: echocardiograph, chest x-rays, ECGs, pulse oximetry. Just want to see oxygen saturation in the body. Treatment: if it is small, keep monitoring them with a pediatric surgeon. Okay, medications: you can involve non-steroidal anti-inflammatory drugs, to help close it. So drugs like what? Indomethacin and ibuprofen can help close it. Diuretics and digoxin just to manage symptoms. Catheter-based closure, the surgical ligation. So open surgeries to tie up it, just like I was explaining. Okay, so that's it for patent ductus arteriosus.